I'm with Christine Nathe, who is a professor at the University of New Mexico. She also writes the public health column for RDH magazine. How are you, Christine?
I'm very good and happy to be with you today.
Good to see you as well. You have two columns in a row, the August 2011 and the September 2011 issues of RDH that were inspired by a chapter that you read in a book titled Historical Perspectives in Public Health and Administration. Can you briefly describe to us what led to you spending time on this historical perspective of public health?
Absolutely. I'm beginning work on my doctorate in public health, and so I'm taking a core course right now in order to apply to a program. And it was one of our selected readings, and I really learned a lot from this chapter, and I got to go one step further because we discussed it in class, and that was really helpful because I got so many different perspectives, and I just really enjoyed this and learned a lot that I thought was helpful to what we're seeing in dental health as well.
Well, the first column, which appears in August 2011 RDH, you compare the beginning of the medical, I should say public health and medicine with dental hygiene. You described the low public acceptance of public health medicine at the beginning due to the lack of accredited medical institutions. And then you concluded the column commenting on perhaps the regression of dental hygiene education due to what you describe as being proprietary schools opening in abundance. Can you comment on that comparison that you made?
Absolutely. The chapter I read really outlined the issues that we had in public health in the 1800s and actually earlier. And one of the issues kind of stemmed from the fact that physicians who were seeing preventable diseases really didn't have a voice in America at the time. A lot of them were trained really in a proprietary nature with other physicians, and there wasn't accredited medical schools like there are now, and they really lacked a voice. So when there were issues that they were seeing that were affecting a lot of people, they weren't able to really get society to make changes to address these issues. And I thought that that was very similar in what we kind of see in dental care right now, because in dental hygiene, what I've noticed since I've been a dental hygienist is that dental hygiene has been progressing not just in science and practice, but also in the value that people have towards dental hygiene and making sure that they're getting their teeth cleaned and asking their dental hygienist about, a specific product that they may be interested in trying. And so I feel that we've been progressing quite a bit, and with that progression, we've had such a progression in the education of dental hygienists, more dental hygienists obtaining baccalaureate degrees, and of course the abundance now, or almost abundance, of master's programs in dental hygiene. So we've really seen the education increase. What's happened though in the last few years is we've had the opening of a lot of proprietary schools that the courses that dental hygienists are taking in these schools are not always transferable to universities that have Bachelor of Science and Dental Hygiene degree completion programs. So I think as a profession, we need to continue to work to advance our education and do what it takes to make sure that most dental hygienists have the opportunity. Really, I would like to see all dental hygienists have the opportunity to get their bachelor's degree and Bachelor of Science and Dental Hygiene programs, as well as master's, and hopefully up to a doctorate sooner than later.
How do you feel like the profession needs to promote its progress in public health dentistry?
Well, what I talked about in the article was these two scientists who were collecting data, and one did a very detailed report with a lot of good information that really had the ability to impact, because when you find out what the public health issues are and possible ways to prevent it, there's a lot that can be done. The other scientist was just wonderful at getting the information and promoting it and working to make societal change in a public health issue. And I think, when I read that, I thought, dental hygienists, with the education that hygienists receive and the skills that dental hygienists have, we really have a lot of background in communication skills and health promotion. And we really are the ones that should be promoting access to dental care for all our members. An example could be that a hygienist association or a local dental hygienist working to create a school-based clinic for a school right in their community. You can get data from the National Oral Health Surveillance System of dental disease and prevention in your state, and there may be other local data available, but make that known and let the leaders in your community know so that you're able to expand dental hygiene to those that may not be able to visit a dental hygienist for whatever the reason. I think that hygienists have those skills already to promote, and we can see you can have all the information in the world, but if you're not promoting it, you're not able to make the change necessary to help improve the public's health.
Thank you very much, Christine. Again, the column will appear in the August and September issues of ODH magazine. Thank you very much for your time, Christine.
Thank you, Mark. Nice to be here with you.